Glad to have you with us. Our Tuesday with You continues. Sometimes you got to make an appointment and go see a doctor. Sometimes you get a very special house call, and that's what we're getting with Dr. Ara Suppiah today. He works with a lot of the pros, but he also is an ER doctor straight from the ER.
I keep telling I'm a real doctor. No one believes me. See?
They should believe you. If they don't already, here's the proof right here. So you're going to run us through some situations that are pretty common, but it is the 1st of May. So when should we call May Day and actually go to the ER? This is a good topic for today, isn't it?
This is a great topic because many times what I see in the ER is people, instead of coming in sooner, they wait till it's late. And then it's very obvious to us as doctors, like, oh, you should have come in sooner. So let me go through a few things that may clear things up for you guys.
Okay, perfect.
Right? So we're going to start with back pain. Okay.
Just everyday back pain?
So very, very common topic, right? So if you have back pain and it flares up, most people go, it's nothing major. But
yeah, just take some medicine and hope it goes away.
And most of the time, if you do that, you should be fine. But there are a few things that if you have this with back pain, don't ignore it. So top of the list, fever, okay? Because that could be a kidney infection, that could be infection of the spine, bad things happen. If you have back pain and fever, as an ER doctor, we worry about stuff. And then things like if the pain gets really bad and you can't walk, your legs get weak, if you get numbness down the legs, if you have incontinence, not a good sign. If you have blood in the urine, that could be a kidney infection, kidney stone that you're passing instead of a regular back pain. And finally, if your belly hurts and you have back pain, not a good sign.
Go get it. Sometimes that just seems to kind of all wrap around together. Maybe lay down and take a nap.
Especially if you get older, it could be your aorta, it could be the bowel. So things can go wrong if this happens. Yeah.
Okay, perfect. All right, moving right along in our topics. What about arthritis? People complain about this a lot as well.
Again, very, very, very common, right? But there are a few things. So let's say you typically have a bad knee, but all of a sudden the knee swells up, it's red, and you cannot move the knee, that's not a good sign because that tells me that the knee could be infected. Okay?
Wow.
Even though you didn't do anything to it, you may have had a cold, it can spread to the knee.
Even if there's not like an open wound or anything else, you could still have an infection.
So if your joints hurt so bad you cannot move it, come see us, right? And together with that, if you have a fever, also not a good sign. There are certain conditions. So for instance, Lyme's disease, Rocky Mountain spotted fever, certain infections, you'll get joints will hurt, and you'll get a fever with it and a rash with it.
Okay.
And finally, if you typically have knee pain, but now your hands hurt, your shoulder hurts, something else is going on. This could be an autoimmune disease. And if you have an artificial joint and that hurts, come see us.
That sounds like it would offer probably
that could be
excruciating
infected.
pain.
Yes, that could be infected, and that's a big problem.
Straight to the emergency room you go. So it sounds like a combination of a lot of these symptoms is really what should make you make that trip. But what about headaches? Now, I deal with these multiple occasions throughout the week.
Again,
when should I actually come see you?
If you have a headache and you look like you, then I'm not worried, right? But if you have a headache and you have a fever, not a good sign.
Got it.
This could be a sinus infection. This could be start of meningitis. Again, with a rash, fever, rash, headache, not a good sign.
But should you just go to like maybe a walk-in clinic? I mean, do you really need to go to the ER?
You could go to a walk-in clinic.
Okay.
Yes, if you feel like you go there, because there are people there who can see you. What I'm trying to say is, if you have this with a regular headache, go get this seen because it could be the start of something, and you don't want to wait too long. One of the things is, if you have a headache, like you have a regular headache, but the headache is different, it's the worst headache you've ever had, that could be a sign that a small bleed in the back of the head.
Wow.
More common than you think. So again, worst headache of your life, persistent vomiting, and then for those of you who have eye conditions, if you have severe eye pain with a headache, that could be glaucoma. Please come to the ER. Please come see us because you could lose your vision.
Listen to Dr. Ara. It's not done yet. So what if you maybe go out to dinner, go to bed that night, are feeling fine, and then all of a sudden wake up, maybe your mouth is watering a little bit. That typically is when food poisoning, stomach bugs, they set in the middle of the night. When should we come see you?
Okay, so again, it's common, right? You go out, eat something, you have diarrhea, you have vomiting. Usually it'll settle, but there are a few telltale signs. So if you have severe stomach cramps with this could be an infection that's spreading to the colon, something called colitis. That's not good, okay? Also, if you see blood in either end, poop or vomit, if there's blood in there, that's not good. We need to see you because that infection is more than just a straightforward food poisoning, right? The last two here, fever again. If you have persistent fever with something like this, especially if you travel abroad, things like E. coli, salmonella, they will present like this. But I put down lightheaded and dizziness. This could be a sign that you are actually dehydrated. Okay. You get to a point where...
Yeah, when is dehydration so bad that
that's when, if you stand up, and this is more common with younger people, when you stand up and you feel lightheaded, dizzy, you probably need to come see us. We need to check your electrolytes. We need to probably start you on a drip.